From my perspective as a solicitor, I was really wanting to break down some barriers. I think most carers are a bit nervous about approaching firms of solicitors. They don't know what it's going to cost, what to ask, who to approach. Does anyone have any specialist expertise in this field? I'm not sure if it's a legal question or a social care question, something to do with social work, something to do with medical professionals. Who do I ask and where do I go for the information? So that project really helped to deliver that information to the carers in an accessible format, and they don't feel overwhelmed or intimidated by approaching a solicitor to ask these questions.
The partnership has enabled Vocal to respond to the need of carers and offer a consistency and a thoroughness that we wouldn't have been able to do signposting carers onto other organisations. We're able to explore the issues with the carers. We then brief Morisons. And where it's appropriate and with the carers' consent, we can then explore these issues further. It offers a levels of service which our carers, who are often very stressed or nervous, they need this level of service to be able to achieve their goals.
People that come to Carers of West Lothian looking for information on power of attorney guardianship, they attend our training courses which run over 8 weeks, and Gillian delivers a session for us there, and not only do the carers go away knowing exactly what they have to do, they know why they're having to do it as well, and it's a great peace of mind for them. And it's a great way for them to meet Gillian and her team, because they come to a relaxed atmosphere of a training course, and although sometimes we'll have Gillian booked in for 2 hours, she's sometimes there for 3 hours.
Informative conferences were held in 2010 whereby people with dementia, their families, their carers, professionals, senior decision makers all came together for an interactive workshops and conference. The outcome of that was that people were looking for a one-stop shop. They were wanting somewhere that they could come to for guidance and advice and always tap into whenever they wanted to. They wanted to tell their story once, not have to repeat it time and time again. So we were looking for developing a pathway for people on their journey of dementia, somewhere that they could come to at any time for advice and support, and signposting that we could point them in the right direction.
Feedback from patients, carers and such like is that they have an easier access into services, they're more aware of what community facilities are available, they find speaking to the one person far more preferable than going round having to tell their same story over and over again. They're happy that the services can come to them, and the feedback is that they prefer to be seen and attended to in their own home rather than having to think about getting organised for a whole day out to go to the hospital to see the doctor, and then a day later having to go back to the hospital to see the podiatrist. We can now get the services coming to people in their own home.
Because we are different disciplines within the team, it means that the person is not having to tell their story time after time, but we are aware of the story and we can introduce another worker quite easily, and hopefully it will reduce anxiety for people. There's also pluses with us learning from each other, understanding each other's disciplines a bit better, and being able to access resources. So pooling resources, accessing resources and accessing training from the different organisations involved.
We brought together the great and the good of both of our organisations at Chief Executive and Director level. But from that very, very first meeting, it also involved representation from the Dementia Working Group. So there was a lady with dementia and sight loss right from the beginning involved, and that had a huge impact. So although organisationally we knew there was advantages in working together, bringing the expertise from both organisations, the whole way through the development it has involved people with dementia and sight loss who have influenced, the partnership and helped us to target the areas in terms of information gaps that we should be looking at. Our main aim was to improve the life of people with dementia and sight loss, and our main objectives were to bridge the information gap, to ensure that there was clear and concise information for people living with dementia and sight loss in Scotland. And also another objective was to ensure that people with dementia could access eye care, could have that vision information explained in an easy to understand way, and that would influence perhaps their care and their support in a real meaningful way.
People sometimes they're anxious about going to an optometrist because they feel, well, if they're not able to recognise letters, they're not going to be able to access a good visual assessment. But we can assure people, we can work with the optometrists too within the community, and to help them to help the people understand that they can have a different approach to the visual assessment, and sometimes just very simple adaptations can make a difference and make a huge difference to the quality of life for the person with dementia.
The partnership element was great. It led on to further training, which has since taken place, and it also, I think, gives us a way forward to look at the overall improvement in eyesight testing and awareness of dementia going forward. So it was a really positive experience.